Hello, good morning, and welcome to another video of this. Hello, good morning, and welcome to this class. We have about 10 modules in this course, and this is module 1. We're going to be learning about personal health and hygiene. And under that, we're going to look at an overview of personal health. We're going to look at an overview of personal hygiene. We're going to look at different types of hygiene. We will look at the importance of personal hygiene. We will look at the relationship between personal hygiene and disease prevention. We will look at common hygiene practices. We will look at cultural, environmental, and social influences on hygiene and behavior. So let's get right into it. What is personal hygiene? What is personal health? Now, there are several ways in which personal health can be defined. We may look at personal hygiene in the following ways. Personal health refers to the well-being of an individual in terms of physical, mental, and social conditions. It involves a conscious effort to maintain a healthy body and mind through preventive and proactive health practices. Health, personal, personal health encompasses the overall well-being of an individual, encompassing physical, mental, emotional, and social health. It's about taking charge of one's health and making conscious decisions that promote wellness and healthy living. So let's look at the different aspects of physical health. Um, Starting with physical health. Physical health is the body's functionality and ability to perform daily tasks without fatigue or undue stress. And it involves maintaining a healthy weight, regular exercise, balanced nutrition, sufficient sleep, and avoiding harmful substances. Healthcare professionals guide individuals towards lifestyle choices that optimize their physical well-being. It also refers to the physical condition of the body, including its ability to function effectively and resist disease. It involves factors like fitness level, nutrition, and bodily function. Another aspect is mental health. Now, the state of one's mental health is equally significant. It pertains to cognitive and emotional well-being, encompassing stress management, coping mechanisms, emotional resilience, and the ability and the absence of mental health disorders. Recognizing and maintaining mental health concerns are essential to promoting overall personal health. Mental health encompasses emotional, psychological, and social well-being, including aspects like mental stability, resilience, and the ability to manage stress. Emotional stress is simply the ability to understand, express, and manage emotions in a healthy way. It involves emotional resilience and the ability to cope with life's challenges. Another aspect is social health. Humans are inherently social beings, and personal health isn't complete without considering social connections and relationships. Strong social networks, meaningful relationships, and a sense of belonging contribute significantly to mental and emotional wellness. Healthcare professionals can encourage patients to cultivate supportive social connections for holistic well-being. It involves the ability to interact effectively with others, build and maintain a healthy relationship, and participate in society. So now let's move on to personal hygiene. What is personal hygiene? Personal hygiene is the practice of keeping one's body clean and maintaining good health through cleanliness habits such as bathing, brushing teeth, and washing hands. It also refers to the practices of maintaining the cleanliness of one's body and clothing to promote overall health and well-being. It includes activities like bathing, washing hands, brushing teeth, and grooming nails, as well as covering coughs and sneezes. These practices help the spread of, or they help prevent the spread of germs and illnesses and contribute to a positive self-image. So what are the types of personal hygiene? We have dental hygiene, which involves more than just having white teeth. A good dental hygiene routine can help prevent issues such as gum disease and cavities. It can also prevent bad breath. The teeth should be brushed twice daily, in the morning and in the night. Another type of personal hygiene is body hygiene. Now, several million sweat glands cover the human body, and when bacteria break down sweat, the process creates a smell or body odor. Washing the body would help prevent skin irritation as well as removing the bacteria that cause body odor. Washing the hair removes oil and keeps a person looking clean and fresh. Another type of personal hygiene we have is hand washing hygiene. Regular hand washing is one of the best ways to avoid spreading communicable diseases. You should wash your hands before, during, and after preparing food. Before eating food, before and after looking after anyone who is vomiting or who has diarrhea, before and after treating a cut wound, after going to the bathroom, after changing diapers or cleaning up a child who has used the toilet, after blowing the nose, coughing or sneezing, after touching garbage or dirty surfaces or objects, after handling pets or pet related items such as food. Now, we also have menstrual and genital hygiene. Maintaining a good menstrual and genital hygiene involves regular cleansing of the genital area, especially during menstruation, using warm water and changing menstrual products frequently. It also includes using unscented products and opting for breathable fabrics like cotton underwear. Proper hygiene practices can help prevent infections and discomfort such as rashes and urinary tract infections. Um, Now, be looking at the importance of personal health and hygiene. Number one is disease prevention. The primary purpose of personal hygiene is to prevent the spread of contagious diseases. Maintaining good hygiene helps prevent infections such as skin infections, respiratory infections, and gastrointestinal illnesses. Regular and proper practices such as hand washing, bathing, and keeping living spaces clean significantly reduce the risk of transmission of harmful bacteria and viruses, such as those responsible for cold, flu, gastrointestinal infections. Another type is another importance is promoting health. Personal hygiene practices contribute to overall health by reducing the chances of falling sick. Proper personal hygiene supports a strong immune system, which serves as the body's natural defense against infections. A strong immune system fostered by good hygiene habits helps the body fight off infections more effectively. Another importance is physical enhancing appearance. Personal hygiene contributes to a neat and presentable physical appearance. Being well groomed can boost self confidence and improve social interaction. Regular bathing, showering, and using deodorant or antiperspirant help prevent body odor, which can be unpleasant and impact social interaction. Another importance is mental and emotional well-being. Feeling clean and fresh positively impacts mental and emotional well-being. Good personal hygiene boosts self-esteem, confidence, and overall happiness. Good hygiene can also reduce stress and anxiety associated with feeling unclean or unkempt. We also have social responsibilities. Practicing good personal hygiene is not only beneficial for oneself, but also for the broader community. Practicing good hygiene helps prevent the spread of diseases to others, contributing to the overall health and well-being of the community. And by preventing the spread of infections, individuals demonstrate responsible behavior towards others, especially in shared living spaces and public spaces. Now, let us look at the relationship between personal hygiene and disease prevention. Hygiene practices reduce the risk of transmission of diseases by killing the germs and microbes that carry the disease. Soaps, sanitizers, and other hygiene products contain ingredients and chemicals that, while harmless to humans, kill these microorganisms. Good personal hygiene should be adopted as part of daily life to stay healthy, to prevent contracting infectious diseases. There is no guarantee, however, that hygiene habits will work with the same degree of effectiveness against every infectious disease, particularly mutations. Many diseases and conditions can be prevented through proper hygiene practices such as covering coughs and sneezes, washing hands after handling animals, and showering before you swim. So let's look at the common hygiene practices. We already talked about hand washing, which is one of the most effective and regular ways to prevent infectious diseases. People always touch their mouth, nose, eyes, and even without realizing it. Therefore, when a person comes in contact with an infectious disease, it can spread rapidly through touch. However, if a person washes their hands correctly, once they come in contact with the relevant microorganisms, they can remove the infectious disease and prevent the spread to their bodies and to other people. To correctly wash your hands, you should use warm water and soap and wash for at least 20 seconds. Another practice is dental hygiene. The mouth is home to millions of organisms such as bacteria, blood, saliva, and oral debris. Without brushing the teeth regularly, infections can be caused by diseases of teeth, gums, and mouth. The teeth should be brushed at least twice a day, but brushing after every meal is even better. Flossing is also a great way to improve and maintain your dental hygiene. Another practice is covering the nose or mouth while coughing or sneezing. When you cough or sneeze, germs carrying the infectious diseases are released, which can then be spread to another person. When coughing or sneezing, it's important to use a tissue, cloth, or the fold between your arms and upper arm to stop the germs from infecting other people. This practice reduces the risk of touching other people or surfaces that they will potentially contract the disease from. And if you cough into a tissue or sneeze into a tissue, make sure you dispose of the tissue straight after, and it is best to wash your hands immediately afterwards. Another practice is washing the body. For good personal hygiene, washing the body is just as important as hand washing. It is recommended that people have either a shower or bath at least once a day. When washing your body, you should use soap and water to effectively clean your skin. When you wash your body, you remove bacteria from the skin, which prevents infections and the spread of diseases. And then we also have another one, which was quite prevalent during the COVID period, which is physical distancing. While good personal hygiene kills microorganisms that spread infectious diseases, physical distancing reduces the opportunity for contact with these microorganisms if they are moving through the community undetected. It is used to avoid close contact between people where infectious diseases can spread more easily. So let us look at cultural and environmental, social influences on hygiene behavior. Now, hygiene behavior is significantly shaped by cultural, environmental, and social factors. Cultural norms can dictate what is considered acceptable um, hygiene practices, while environmental factors like access to water and sanitation facilities influence the physical feasibility of proper hygiene. Social influences include family, peers, and media can shape a person's understanding and adoption of hygiene behaviors. So let's look at all of these categories of influences, starting with cultural influence. Now, these are norms and they can be norms and values rather. Different cultures have varying views on personal hygiene. Some cultures emphasize cleanliness, while others may be less concerned with body odor or certain hygiene practices. They also have traditional practices. Many cultures have their own unique ways of maintaining hygiene, often rooted in ancient traditions and beliefs and symbolism and ritual. Certain hygiene practices can be deeply symbolic and may be associated with cultural or religious beliefs. Now, environmental influences. We have factors such as access to resources, availability of clean water, sanitation, facilities, and hygiene. Products directly impact hygiene behavior. Limited access to resources can make it challenging to maintain proper hygiene. And also the physical environment. The physical environment, including living conditions and access to clean spaces, can also influence hygiene practices and infrastructure. Adequate sanitation infrastructure is crucial for preventing the spread of diseases and promoting overall health. And lastly, we're looking at the social influences. So individuals learn hygiene behavior from families, peers, and broader social groups. We also have the media. Media messages and advertising can shape perceptions and attitudes about hygiene, sometimes promoting unrealistic ideals. We also have education and awareness. Formal and informal education play a crucial role in promoting good hygiene practices and raising awareness about the importance of health and sanitation. And we also have socioeconomic factors. Socioeconomic status can influence access to resources, education, and healthcare, impacting hygiene behavior. So we have come to the end of this module. Thank you for listening. In the next class, we'll be talking about nutrition and hygiene. So see you in the next module. Bye bye.